Today, Group 4 will be presenting a PowerPoint on improvements to prevent acquired pressure injuries at Southern Hills Hospital. Our group members included myself, Devontae Mitchell, Ruby Bickerton, Austin Hale, Emily Sweat, Garrett Bassam, Maggie Dennis, Mary Miller, and Kennedy King.
Hi, my name is Ruby Bickerton, and I'm going to be doing an overview of quality safety initiatives at Southern Hills Hospital. I'm going to start off by explaining what a quality dashboard is. Quality dashboards help patient outcomes by providing data to utilize in ongoing treatment. In other words, stated by Ulcers, quality dashboards is a condition-specific, actionable web-based application for quality reporting and population management that is integrated into an electronic health record. Quality indicators and performance measures are also used. So quality is the health service that people receive to increase positive health outcomes, and indicators are evidence-based quality of care, so they explain why a certain practice is necessary for the best patient and are often based on data, sometimes from electronic medical records or from surveys. Performance measures quantify a process of care that has been shown to provide positive outcomes to patients and healthcare facilities. Relating this to an organizational and unit level, a quality dashboard provides information on standardized performance metrics at a unit or organizational level to leaders to assist with operational decision making. Dowding also said that health IT provides a visual display of quality or productivity indicators to enable managers at the organizational and/or ward unit level to identify areas of practice for improvement. Data is needed to provide this information and is collected during interviews with the patient to determine first-hand experience of the care that was provided to them. Their answers are directly quoted via transcription from a recording. And this process is very important because quality dashboards can lead to the identification of previously unnoticed patterns in data, performing quality measure improvement initiatives, and more efficient and effective decision making.
Hi, my name is Mary Miller, and I'm going to be talking about the data results for pressure ulcers at Southern Hills Hospital. So the first thing I want to talk about is quality indicators. So what are quality indicators used for? Quality indicators are used to measure care quality from hospital data. At Southern Hills Hospital, the goal was to have 0 for the number of hospital-acquired pressure injuries, and according to the data, this did not occur. As defined in an article from the Journal of Tissue Visibility by Jay Kottner, these factors are used in determining pressure injuries. The Braden scale is used to identify the risk for pressure injuries. If a patient scores a 14 and below, they are considered high risk for developing a hospital-acquired pressure injury. The goal of hospitals is to reduce the number of hospital-acquired pressure injuries because hospitals are required to pay for the supplies necessary to treat that injury, and it becomes very costly. What is a pressure ulcer? According to Smith in the Journal of Health Affairs, a pressure ulcer is defined as localized damage to the skin and/or underlying tissue as a result of pressure or pressure in combination with shear. This injury involves damage to the soft tissues of the skin, including the epithelial, dermal, and subcutaneous tissues, such as fat or muscle. These injuries are caused by prolonged immobilization and pressure on the surfaces of the skin. Pressure ulcers are defined similarly nationally. Pressure ulcers are staged according to their severity. A stage 1 pressure injury is a non-blanchable erythema of intact skin. A stage 2 pressure injury is due to partial thickness skin loss with exposed dermis. Stage 3 pressure injury is full thickness and skin loss. And then there is also a stage that is determined as unstageable, which is commonly found in necrotic tissue. When defined whether or not a pressure ulcer is hospital-acquired, nurses take careful assessment because defining one as hospital-acquired presents liability and a huge expense to the hospital. As described in the American Journal of Critical Care, the Braden scale is used to identify the risk for pressure injuries. The goal of hospitals is to reduce the number of hospital-acquired pressure injuries because hospitals are required to pay for the supplies necessary to treat the injury, and it becomes very costly.
My name is Emily Sweat, and I'll be discussing the impact that pressure ulcers have on healthcare. In order to understand the impact that pressure ulcers have, it's important to understand what a pressure ulcer actually is. Pressure ulcers are injuries to the skin and underlying tissue primarily caused by prolonged pressure on the skin. According to an article by Mervis published in 2019, pressure ulcers typically begin when the individual's body weight exerts a downward force on the skin and subcutaneous tissue that lie between a bony prominence and an external surface. Pressure ulcers can also occur by continued pressure from medical devices. This could be from oxygen tubing, EKG leads, telemetry boxes, bedside rails, basically anything that the client could lay on and experience an increase in pressure from. Some of the possible complications of pressure ulcers are cellulitis, necrosis, septic arthritis, osteomyelitis, squamous cell carcinoma, and sepsis. In addition to these, the clients may experience fear and anxiety regarding their condition, a decrease in independence, and in turn, the client might feel isolated. Pressure ulcers are very common, and in order to prevent this problem, it is important to understand why they are so common. Pressure ulcers are more common in geriatric clients. This is due to the decreased skin elasticity and poor mobility associated with aging. Pressure ulcers are also common in clients who have injuries that impair their mobility. This could be from spinal cord injuries, external traction, paralysis, basically any injury that would prevent the client from repositioning themselves. Healthcare team members are responsible for turning these clients. They're supposed to be turned on regular intervals of at least every 2 hours. Unfortunately, staffing can sometimes be limited and these clients aren't always turned as they're supposed to be, which in turn leads to pressure ulcer development. Incontinence is also a major issue with pressure ulcers because increased moisture leads to skin breakdown, and unfortunately that can cause a pressure ulcer to develop if left untreated. As I discussed earlier, medical devices also cause pressure ulcers. If a client is left on the device for too long, that pressure can build up and the client is oftentimes unable to position themselves and remove the device, which causes pressure ulcers to form. Poor nutrition also greatly contributes to pressure ulcers because weight loss caused by poor nutrition leads to a decrease in collagen, which provides less cushion for bony prominences and leaves the clients more susceptible for sore development. Pressure ulcers are fairly common, which is why implementing a plan to reduce them is so important. According to a 2018 survey done by Kaiser, 117,988 patients and 1,115 facilities in the United States and Canada were evaluated for pressure ulcers. Of these 117,988 patients, 10,179 of them had pressure injuries with a prevalence of 9.9%. 3.7% of these were facility acquired, meaning that the residents gained these pressure ulcers while at the facility. These are very common among nursing homes and other facilities where the clients stay for an extended period of time, and in facilities where the clients are less able to move themselves, which is why it's so important to try and implement a plan to reduce these as much as possible.
My name is Maggie Dennis, and I'm going to be discussing how to implement change to improve patient care and outcomes related to pressure ulcers. First, I'm going to be talking about best practice interventions. Prevention is the first step in taking care of a patient who is at risk for pressure injuries. Prevention includes assessing staff knowledge as well as the pressure relief equipment and skin care products, performing regular skin assessments, developing an individualized care plan, and frequent turning and repositioning. One of the keys to avoiding pressure injuries is to educate staff on the importance of implementing these interventions and ensuring staff understanding. According to the article by Padula published in 2016, the 5 quality indicated interventions include leadership initiatives, visual tools, pressure ulcer staging, skin care, and nutrition, which are used for pressure injuries to reduce hospital-acquired pressure ulcers. The implementation by staff is what controls whether results are seen or not. The importance of administrative staff being behind the education, as well as visual reminders placed around the hospital, lead to an increase in cooperation by staff. According to Jacobson, published in 2016, the reportable pressure ulcers that were deemed avoidable decreased by 67% between 2010 and 2013. In order to implement interventions to prevent hospital-acquired pressure ulcers, it is imperative that the necessary supplies such as skin creams, dressings, things to control moisture, underpads, and the correct diet are provided to the staff for the patients. Once the materials are added to the hospital, posters and flyers can help encourage and remind staff of the importance of using the interventions provided. Another way to ensure these interventions are put in place is to update documentation in order to regularly keep up with what is being used. According to the article by Padula published in 2016, the NPUAP and the Agency for Healthcare Research and Quality endorsed an evidence-based prevention protocol that consists of risk assessment for pressure ulcers, for example, Braden scale, as well as an assessment of other clinical factors of patient risk, repositioning, skin care, moisturizers, managing moisture and incontinence, nutrition, modern support surfaces, and continuing education about prevention. In order to make a change within the hospital, educating the nursing staff on the equipment and interventions that work best and prevent pressure injuries is the priority. Once the staff is aware of the changes needed to be implemented and how to implement them, flyers and posters should be placed to remind them. The intervention should also be placed in the staff's documentation to educate them on how frequently they should be done. The staff can educate patients as well so they can advocate for themselves.
Hi, my name is Devontae Mitchell, and I was tasked with the objective to talk about monitoring the change of pressure injuries at Southern Hills Hospital. The EHR can help facilitate quality improvements by streamlining quality improvement and documentation through skilled quality improvement teams and system redesigns that help improve patient health outcomes and system performances. System usage aims to be user-friendly. This helps nurses, doctors, and other healthcare professionals included in the patient's care plan to have access to all the information necessary to provide proper change. This includes medical history, important notes, and treatment and discharge plans. The EHR helps facilitate data collection. This is beneficial because it provides timely feedback for all parties to see and allows team members to monitor for effects of changes in their practice over time. The EHR also stores health information so team members can track relevant data over time by using event logs. Timely records can be made for pressure injuries, fall incidents, and other disease acquisition that may have occurred during the hospital stay. The EHR also helps with medication administration to prevent errors and prevent patient harm. This is especially true for look-alike or sound-alike medications. Barcoded medication administration is a major system that links to the EHR and ensures the right patient receives the right medication at the right time. The EHR helps to improve compliance among team members through safeguards that ensure the correct amount of checks and patient identifiers have been completed before care is given. One article showed quality improvement teams play a role in improving staff compliance. Practice facilitators were trained by acting as liaisons between individual practices and research institutions. The EHR is crucial in providing care for falls or pressure injuries because the whole healthcare team can see the progress made for the wounds. The documentation portion is vital to ensure that information is up to date and patient care is largely dependent on the proper usage of this streamlined system. The nurse must accurately input the information so pressure injuries can be tracked and monitored throughout the healing process.
This slide is the nurse's impact in healthcare and pressure ulcers. The first bullet point is the role of the nurse. The role of the nurse to improve quality in pressure ulcers is to reposition the client, frequently use support surfaces to reduce the risk, and to assess for moisture. The role of the nurse overall is to reduce the risk of the pressure ulcer and to treat it properly if one does occur by using dressings, and to change them frequently. The second bullet point is the nurse's impact on pressure ulcers. The nurse's impact on pressure ulcers is major. They prevent them and treat them as the nurses do their educated duties on treating, preventing, and educating these ulcers. The patient trusts the nurse and knows that he or she is doing the best they can do to help them. The third bullet point is initiatives to reach an organizational goal. The initiatives as a nurse can make to reach an organizational goal would be to turn the patients as much as you can during a shift to prevent these ulcers from happening, as well as assessing for any moisture around a pressure area. The next one is improvements a nurse can make to help healthcare. Improvements a nurse can make to achieve buy-in with not only the staff but with all levels of healthcare would be to show appreciation and to respect and show respect in the work environment, and to involve everyone with decision-making events. The last one is monitoring change and data collection. The role of the nurse in monitoring change and data collection is to assess for changes on the patient, to assess for healing or even worsening signs and symptoms. The nurse's role in documenting is to record them in their documentation system. Nursing care documentation is an important aspect of clinical decision-making processes and affects patient safety. This documentation system helps communicate between nurses and providers to help the patient get the best care they provided.
Hey guys, this is Kennedy. So I'm basically just going to wrap up everything that we talked about in this presentation. So just to give you a reminder on pressure ulcers and what they are, they're just a type of injury that results from skin breakdown when an area of skin is unrelieved of pressure for an extended amount of time. And this breakdown of the skin can cause cessation of oxygen to that particular area, and then the affected skin can become necrotic if interventions aren't taken. So, as far as significance goes, the majority of people affected by pressure injuries are those having health conditions that encourage immobility, especially those who are confined to a bed or chair for a prolonged amount of time. But pressure injuries can affect anybody, and that's why to observe the performance deficit on admission to an acute care facility, there will be a required skin assessment to identify the client's pre-existing skin conditions. So if any client being admitted seems to be at risk of developing a pressure injury, interventions can be taken to initiate the prevention of the skin breakdown and maintain their skin integrity. The most common assessment tool for pressure injuries is the Braden scale. It evaluates the severity of multiple factors that can lead to injuries such as immobility status, moisture levels, and friction. Repositioning clients who are immobile is part of a nurse's role in the prevention of pressure injuries. So, how often a nurse repositions a client is determined by the status of the client, how well they can move, if they're immobile, what their level of consciousness is. But an immobile client will be repositioned by the nurse at least every 2 hours to prevent pressure ulcers. Patients with excess skin moisture will have to be treated by drying agents and compounds intended to protect exposed areas from maceration. And how electronic health records can come into play is by they aid the prevention of pressure ulcers because it allows the healthcare professionals to document the client's current status related to pressure ulcers. On admission, nurses perform skin assessments to identify any client's conditions prior to admission. That way, the injuries acquired during the hospital stay are easy to identify. The information is stored in the electronic health record, so healthcare professionals can refer back to, update, or document any changes that occurred during admission. Electronic health records make for easier and more effective care for clients due to its ability to store the needed information to prevent and care for clients who have pressure injuries.